Is it normal to fart without stopping for like 30 seconds? Oh, good questions. Brace yourselves, this could get a little out there because today we are back at it answering some of the most thought-provoking medical Discord questions. All right, let's dive right in. First question, is it true you can actually grow horns out of your head from poor posture or looking down at your phone too much? Actually, really good question, because first thing I think about somebody saying growing horns out of their head is like horns coming out of your head. No, you wouldn't grow those. Sometimes people do get these abnormal skin growths, and they're actually called cutaneous horns, and it's actually cornified tissue, but that is not from looking at your phone. It wouldn't be a horn, but it could be a bone spur. If there is tension on where your muscles and tendons attach to a bone, it can actually start pulling on the bone very slowly over time, and the bone can actually grow a little bit. So question number 2, is it normal to fart without stopping for like 30 seconds? So yes, you can fart for a long period of time due to the fact that you have excess gas in your body. If somebody has that much gas in them, it's actually going to cause abdominal distension and feel really uncomfortable. But you know what's very interesting? The Guinness Book of World Records has a fart that goes 2 minutes and 42 seconds in one continuous fart. What? I need to hear that. I wonder if it actually really smells, or is it SBD? Is it silent but deadly? Or is this one just super loud and doesn't smell at all? Question number 3, is it possible to strangle someone with their own intestines? Yeah, not really. You see this a lot in video games where all of a sudden the intestines come out and they're just like these tubular structures with no attachments. That's not how it is in real life. They're all attached. The small intestines are attached by what's called mesentery. It's connective tissue that keeps it kind of in a ball. You know, unless you're able to rip that, very much unlikely in the intense scenes that we would probably see in movies. Okay, here we go. Question number 4. Why, when I have an erection, does my pee come out in 2 streams? Oh, good question. So usually it's not anything crazy scary. Usually there's some ejaculate that might be stuck still in there. Your prostate could be inflamed and has something called prostatitis, but also just in general, you have an erection, you have swollen tissue, so your urethra, which is a tube where the urine comes out of, could be compressed a little bit, so it actually might squirt kind of through the sides. As long as you're having a normal stream when you urinate without an erection, everything is most likely fine. But just wait a second, let the erection go down and urinate as normal. Just go, man! Question number 5. Oddly specific. I cuddle with my girlfriend every night, and a lot of the time when I wake up, my skin has these weird red marks that look like her dreadlocks. What could this be? Should I be concerned? Great question. Obviously, we can get inflammation of our skin for multiple different reasons. You know, I need to see specifically what it looks like. But the other component of this is because, you know, you're laying there, you're falling asleep, there's a compressive force, which then when it's relieved will cause redness to the area and in the shape of whatever you laid down on. So it could be as simple as that as well. Question number 6, will I have to be gluten-free my whole life if I was born with it? You know, if you just have gluten intolerance, there potentially are some over-the-counter medications that you can use to help with that sensitivity and help with digestion, help with the bloating and the uncomfortability. If you actually have celiac disease, then because it's an immune reaction, you know, trying to take over-the-counter supplements will probably not help you. And you do have to be concerned if you continue to expose yourself, then actually you can cause long-term damage to your intestines. So avoid the gluten, but get a formal diagnosis to confirm. Okay, question number 7. I feel like I have 2 balls in one ball sack, like there's another one connected to it. Is it like normal? Maybe a spermatocele? It doesn't hurt or itch or cause problems. Very interesting. This could be multiple different things. Most of the time, it's probably something like a small pocket of fluid, but you need to get checked out because you really want to make sure that this isn't cancer. If you have testicles, you need to be doing self-exams and making sure you don't feel any lumps or nodules or abnormal growths on them. If you do, you need to get an ultrasound of your scrotum and you need to see a urologist. Question number 8. So I'm trying to eat more healthy and work out more, but now I feel lightheaded after eating less than I normally do. Should I be worried? Well, yeah, a little bit. You gotta be careful, right? One, you have to think about hydration status, so make sure you're getting enough fluids. And then the other component is your energy expenditure is now higher, but you're potentially taking in less calories. Is it a blood sugar issue? Are you not eating enough and your blood sugar is dropping? You do need calories in any exercise routines that you're doing, and so please be careful. Definitely discuss what your diet habits are with somebody who is knowledgeable in this area and can help you and prevent these symptoms from happening. Question number 9. Why is it a popular myth that popping or cracking your knuckles will give you hand issues later in life? Oh my gosh, yes, we need to put this thing to bed. There hasn't actually been any evidence that doing this excessively will cause arthritis. There was even a physician that did an experiment on himself where he cracked his knuckles for 60 years and showed no evidence of bad arthritis or injury to the hand. Caveat, you can cause injury if you're not doing it correctly, but will all of these things cause major issues just from that popping mechanism? No. All right, question number 10. If air got under skin and made human bloat, is there a balloon syndrome for the human body? There is something called aerophagy, which basically is excess swallowing and ingestion of airs. But there's the other component. Usually it's trauma and injuries, where if there's a cut, you can get some air into the skin itself. I see people who get fractures of the face, where if they sneeze, the air shoots up into the skin and dissects the skin, and we call that subcutaneous emphysema. So there is a huge spectrum of what could cause air within your skin. All right, question number 11. Does it affect your health to be a cannibal? Yes. So cannibalism is basically eating one's own species. So, humans are pretty much hardwired not to do that. Now, obviously, there's also the health components. If you end up eating another human's brain, there's a disease called Kuru that is similar to mad cow disease. And it has to do with the prions that are in the brain that can then actually cause you to be really sick, start trembling, and then actually could lead to your own death. So no, nobody in the human species should be eating another human being. All right, question number 12. I sneeze so hard that it feels like my insides are hurting. My lungs is burning up, my neck is swollen up. Is it a side effect of my allergies, or is there something really wrong with my body? Sneezing is a reflex that we have in our body and is trying to expel whatever is causing the irritation. But be careful if you're sneezing really, really hard. You can have muscle strains, and you can actually cause tears within your tissue. You can actually cause a pneumothorax sometimes, have a collapsed lung because of it. The other thing is you can have irritation of your lung lining, which is called pleurisy. It's multifactorial. It's really hard to kind of narrow that down, but it is definitely something that needs to be addressed if you continue to have these types of symptoms. All right, that's some really interesting Discord questions. You have any unusual or thought-provoking medical questions, definitely drop it in the comments below. If you enjoyed this video, make sure that you binge watch this entire playlist where I answer a ton of interesting medical questions. And please make sure you subscribe and turn your bell notifications on. Thank you so much for watching, and stay healthy, my friends.